just a moment. Good morning and welcome to the COVID-19 provider webinar this Friday, May 19th, 2023. We are going to be together this morning from 9 a.m. to 10:30 a.m. or as long as questions are being asked regarding COVID-19 vaccine and COVID-19 therapeutics. That's right, 2 for 1 this Friday. As we move on to our next slide, my name is Leslie Amani on behalf of the California Department of Public Health. It is my pleasure to welcome all of you attendees. Great to see so many of you joining, and we had early arrivals who were hopefully enjoyed a little music and were moving before we got into the webinar today at 9. I'm joined by a wonderful webinar support team of Rachel Jacobs, Blanca Corona, Charles Roberts, and Billy Dawn Greenblatt. And we are here to support the call, such as dropping in the chat the link to today's slide deck. And we're going to talk more about that in just a moment. But we also want to invite you during today's session to ask your questions. Our CDPH panelists and subject matter experts for COVID-19 vaccine and COVID-19 therapeutics will be on the call and they can respond directly. So please look for that Q&A double talk bubble icon you see on the left of your screen right now. That's our slide showing you where to find it. Mine is in the bottom banner. So if you're not familiar with Zoom, you want to pop that open and you can ask questions or make comments. We are also having a drum roll, please, knowledge checks under the storage and handling section later. So you're going to want to know where those 3 vertical bars are under polls. Those will pop up later in the program. Again, chat is where we drop resource links, such as the slide deck. That includes all the links we're highlighting today. And of course, your reactions are always welcome. And speaking of, if you are a brand new Friday attendee, this is your first inaugural Friday provider webinar, give us a thumbs up and let us know if you are new to the call. We'll move on to the next slide, please. Housekeeping. Panelists, please mute yourself when you're not speaking and do monitor the Q&A panel for questions you may be able to answer. And I did see a thumb pop up, so we're glad to have someone new on today's call. If you would be so kind, you can open up your Q&A, add your name and where you're from. We'd like to welcome you by name. And to highlight for any new or returning providers who need a refresher, we do record these sessions. You can access today's slides already through the link, and the recording later and other archive presentations are available on the EZIZ COVID education webpage. If you have any post-webinar questions, please reach out to me, leslie.amani@cdph.ca.gov. And another quick tip, anytime you see orange underlined links under the vaccine section, whether it's in the body of the slide or in the bottom blue banner, those are links to drive you toward resources, email addresses, job aids, and much more. Next slide. Our agenda today includes some announcements. Then we're going to hear the updates for vaccine administration data from Sharon Brummett, clinical update with Dr. Katarina Liu, storage and handling, and hint, hint, those knowledge checks are coming, so pay special attention to Catherine McHugh this morning for that update. Vaccine management with Josh Pocus and Claudia Aguiluz. We have COVID-19 vaccine quality assurance information from Francisco Borboa. Then we'll have resources and Q&A time before we move into our agenda for COVID-19 therapeutics. Next slide. All right, moving to our first announcement. Lucretia Renteria from Mendocino Coast Clinics, welcome. We are so glad to welcome you to your first Friday provider webinar. If you have questions at any time, please drop them into the Q&A, but we're glad you are joining us. And if you've just joined the call and you are a new attendee, please feel free to drop your name into the Q&A. All right, marking your calendars, looking ahead, Monday, May 29th, in observance of Memorial Day, we will not have the My Turn, My CAVAX office hours on that day, and the COVID-19 provider call center will be closed. So plan ahead for that. Next slide. upcoming webinar using social media to counter COVID-19 misinformation. We wanted to highlight this again for Wednesday, May 24th from 12 p.m. to 1 p.m. Please join Dr. Ilan Shapiro, and I always say he is a spicy and lively presenter, very passionate about all things COVID-19 vaccines and therapeutics. And Dr. Shapiro is going to give us information on using social media to counter COVID-19 misinformation. This is part of CDPH's partnership with hashtag This Is Our Shot, hashtag Vacunate Ya. If you'd like to learn more about the Crucial Conversation series for COVID-19, that bottom blue banner will take you to the webpage. Next slide. We also wanted to just say Dr. Erica Pond, State Epidemiologist and Deputy Director, Center for Infectious Diseases, is going to be with us next Friday for the provider webinar. Dr. Pond will come and share a few items with all of you, and we hope you will be able to attend again Friday, May 26th provider webinar. Next slide. Just a shout out to the vaccine product guide being updated. Again, this was updated on the 9th, but we wanted to bring it forward again. Dr. Liu will talk in further detail about this, but again, just knowing this is a job aid that is available to you regarding COVID-19 vaccine products. Next slide. We also wanted to highlight the vaccine timing guide being updated for routine schedule and moderately and severely immunocompromised. Again, Dr. Liu will go into further detail about these items, but this job aid is available in English. And on the next slide, you'll find that the Spanish version is now updated. So very happy to see the timing guide as of 5/15 get updated in Spanish. Calendario de la vacuna COVID-19. Next slide. And just a reminder, if you haven't heard, there is a long-term care facility COVID-19 module training available for a June 1st and June 7th session. The Zoom registration link is on the slide, and these are new updates to the National Healthcare Safety Network, NHSN, long-term care facility, that's the LTCF, COVID-19 module surveillance pathways. So please feel free to register for those opportunities if you would like to learn more. Next slide. All right, as we begin our updates, a reminder, the Q&A is your opportunity to ask questions. Some may be provided in the update themselves, and we'll go ahead and dive right in to hear vaccine administration data with Sharon Brummett. Sharon?
Thank you so much, Leslie. Good morning, everyone. Next slide, please. So as of today, we've administered 88.9 million doses throughout the state. And of those, 7.5 million are bivalent booster doses. These count includes bivalent doses administered to infant and toddlers. Next slide, please. A total of 89,349 bivalent doses were administered, down 12,481 from the prior week. However, prior to this week, week-over-week trends showed an increase in doses administered among the 65 and older age group since the approval of an updated booster dose among that age group and the immunocompromised. Next slide, please. This slide illustrates trends in booster uptake by age group. Statewide, 18.8% of the total population has received a bivalent booster. And we see that 25.9% of those eligible received the bivalent booster. Next slide, please. There are 21.5 million people across all healthy places index quartiles that are still eligible for the bivalent booster. The gray bar shows the percentage of the population in each quartile that would benefit from the bivalent booster, whereas the colored bar shows the percentage that has already received the booster. The statewide average is 26%. The percentage having received the booster doses ranges from 15.3 in HPI quartile 1 to almost 37.2% in HPI quartile 4. Next slide, please. This next slide shows geographic trends of the bivalent doses administered in the past 30 days to those 65 years and older by California counties. The size of the circle markers represents the number of bivalent doses administered within each county. We see the highest rates along the coastal counties, ranging from 0.2 to 8.9. Next slide, please. In summary, the state has administered 88.9 million doses total and 89,000 over the last week. 1,000 new infant and toddlers initiated their primary series, and 8.5% have completed their primary series. 7.5 million bivalent doses have been administered, with a statewide bivalent booster rate of 25.9. That's it for me. Thank you very much. And back to Leslie.
Thank you so much, Sharon. Appreciate that update. And wow, that closing in on 89 million doses coming our way. Let's go ahead and move on to our next slide and presenter. And we now have a clinical update to review with Dr. Katarina Liu. Katarina?
Good morning and thank you. Next slide, please. So in today's update section, there are no new guidance updates, thankfully. So today's materials are all just review of material that we've covered previously, and I won't go into depth, but I just wanted to remind you of the resources that we have available. So as a reminder, CDC's interim clinical considerations has been updated. So if you have very detailed questions around, let's say, revaccination, people who've had bone marrow transplants, things like that, please do check out the CDC guidance. I find that Control Find often gets you the information that you might need, but happy to answer questions in Q&A. Our timing guides, as Leslie has mentioned, have been updated, and I'll just again remind you of what's in there. And then the FDA fact sheets have also been updated as of the end of April, so please do take a look at those. I know that many of you have been asking about CDC's standing orders. It looks like it still hasn't been updated yet, but we do know that CDC has been working on that. So we'll let you know when we find out as well. Next slide. Just as a reminder, this is the COVID-19 vaccine timing guide with a routine schedule. I do understand that some have asked about incorporating the word booster into the timing guide, and we are reviewing that request. As you know, that CDC has changed their language around COVID-19 vaccines. They've mostly tried to stop using the word booster for the mRNA vaccines, and it's only incorporated for Novavax vaccine. So I think one of the challenges will be trying to incorporate what the previous recommendations were and then what we anticipate might be in the fall. So just want to let you know that we have heard that request, but for the moment, our timing guide is consistent with what's on the CDC clinical considerations guidance around the number of doses for children and for adults. And I pointed out before, but it tells you on this guide what to do if someone hasn't been yet vaccinated, and then what to do if someone has a previous history of monovalent doses. Next slide. I also wanted to highlight again that the guide for immunocompromised individuals has been updated. If you haven't taken a look at it yet, it's now separated into 2 pages, one for pediatric populations and one for adult populations, just given how complex the guidance is. So please do take a look. Next slide. And then finally, this is again a screenshot of the same guide, but for adults. And one of the recent updates in the last couple of weeks was that we put a marker here to indicate that all the J&J vaccine has now expired and what to do if someone got some previously. Next slide. And then finally, I just wanted to remind you of the job aid that we have alerting you to the subtleties around the use of the Moderna vaccine for children 6 months to 5 years. So as a reminder, there are certain situations where the pink cap vaccine should be used as are fairly limited, and for the most part, the blue cap vaccine should be used. And so all of that is summarized on this job aid. Next slide. We also wanted to let you know that the clinical talking points for pediatric providers has been recently updated. We do review all of our materials and make sure that they are updated with the most recent information. So please do take a look and use this. Hopefully this is a helpful tool as you work with families. Next slide. So finally, I just wanted to remind you of a few meetings that have passed and are upcoming. So CDC's COCA call happened last week with lots of detailed slides on some of the reasoning for the changes and then some very detailed flow charts. So please take a look at the recording and meeting slides for more information. And then as a reminder, FDA's Vaccines Related Biologic Products Committee is meeting on June 15th to discuss the future formulation of COVID-19 vaccines for the fall. And then also a meeting of ACIP in June as well, their routine meeting, and we anticipate there will be more information shared about COVID-19 vaccines there as well. So more to come. And with that, that's all my update for today, and I'll hand it back to Leslie.
Thank you so much, Katerina. If you have any clinical questions related to COVID-19, please add them to the Q&A. We do see some questions coming in already. And Dr. Liu, you might just be able to answer Denise's question right now. Question about standing orders. Was there any update for standing orders? Is that something you might be able to answer?
That's a great question. We are still waiting for CDC as well, but please do check the CDC page in case they updated this week, but we will keep checking and trying to update you as well.
Thank you for the question and thank you for the answer, Dr. Liu. Let's go ahead and move on to our next slide. And all right, I'm giving you fair warning. Kate's going to challenge you all this morning with some knowledge checks. It's meant to check for understanding after her update. So let's dive right in with Catherine McHugh for storage and handling. Kate, go right ahead.
Thank you. Next slide, please. So today I'm going to be reviewing waste just because it's something we haven't reviewed in a while. So when should providers dispose of vaccines? You should dispose of the vaccine when the vaccines have reached their expiration or beyond use dates, when they've encountered temperature excursions, if they're no longer authorized, if they're damaged, and those are just a few of the reasons. Next slide, please. And then how you should dispose of vaccines. So physically, you should be following your facility's medical waste protocols, and you should be disposing of them in a pharmaceutical waste container or a commingled pharmaceutical sharps waste container. And then it's important for you to report the disposal of the vaccines in MyCAVax. Next slide, please. And then so when you're reporting your vaccines, your vaccine disposal in MyCAVax, it's going to ask you what type of waste it was. And there's three options. There's waste, spoiled, and expired. So waste is referring to some of the examples are if the vaccine was deauthorized by the FDA, like the monovalent, Moderna, and Pfizer, if it was a punctured vial that reached its use by limit. So for example, you punctured it and we're supposed to use it in 24 hours and it's 30 hours now. If you were unable to draw the maximum doses printed on the vial label, if the vaccines were drawn into the syringe, you pre-drew them before patients and maybe the patients didn't all show up, so you didn't end up using them all. If the vials were damaged, like you dropped them, or if you lost vaccines or they're just unaccounted for. And then spoiled would be temperature excursions, and expired is if they reach their expiration date or they're beyond use date. Next slide, please. And then I'm going to cover how you report waste for the Moderna Blue Cap vaccine again this week, which we covered last week, but one of my examples was a little confusing and incorrect. So I'm just going to recap it again. So CDC has defined the maximum amount of waste that can come from these vials to be 5 doses. And you're counting all doses as if they were adult doses. And if you remember the vial that you can pull either up to 10 pediatric doses from, or 5 adult doses from. So that's why people get a little bit confused on how you report the waste for it. So if you pull 1 adult dose from the vial and waste the rest, you would report 4 doses wasted. And then same if you pull 1 pediatric dose from the vial and waste the rest, you would report 4 doses wasted. And then if you pull 3 pediatric doses from the vial and waste the rest, you report 2 doses wasted because the 3 pediatric doses, you are acting as if those were all adult doses for waste purposes. So that would mean you've administered 3 out of 5 doses and 2 are wasted. But this is just for waste reporting purposes. You can pull up to 10 pediatric doses from the vial, but this is just for how you report waste in MyCAVax for these vaccines. Next slide, please. Okay, so now we're going to move into the knowledge checks. So our first knowledge check, Leslie, do you want to pull it up, or should I read it out first?
If you want to read it out first,
Okay.
that would be great. And then we'll take over and then jump back.
All right, so if your vaccines experience a temperature excursion and the manufacturer determines the vaccines are no longer viable, how should providers report the doses in MyCAVax? So which option should you select when you're reporting it in MyCAVax? And the options are waste, spoiled, or expired.
Great. We're going to pop that up right now. Again, if vaccines experience a temperature excursion and the manufacturer determines the vaccines are no longer viable, how should providers report the doses in MyCAVax? Waste, spoiled, expired. There are almost 400 of you on this call. I see 32%, 33%. Dive right in and give your answer. And again, we have these knowledge checks. It's a good check for understanding. Quite frankly, there is a lot to manage and we realize that. So we want to make sure you have a gauge of what this answer is, so you know how to better educate your staff or some tips and tricks that Kate can provide. So thank you. We've got almost 50% of you participating at this time. Let's go ahead and keep those answers coming in. Again, knowledge check 1 on reporting. If vaccines experience a temperature excursion and the manufacturer determines the vaccines are no longer viable, how should providers report the doses in MyCAVax? Waste, spoiled, or expired? So what we're going to go ahead and do, if you would, let's go ahead and end the poll. And we're going to share the results with the group so you can see how folks responded. So you can see that 22% said it should be reported as waste. 78% said spoiled. There were no answers for expired. Kate, would you like to share the answer?
Yes, the answer is spoiled. So spoiled is what you choose when you had a vaccine that has a temperature excursion and the vaccine is no longer viable. And then waste would be, for example, you punctured the vial and didn't use it all in time, or you pre-drew syringes and had to dispose of them, or for the deauthorized vaccines. So in this case, you would choose spoiled. And we can go on to the next knowledge check, Leslie. Okay, so our second question is, you draw 2 pediatric doses from the Moderna Blue Cap vaccine. So that's the one I was talking about a few slides previously, where you can either administer up to 10 pediatric doses or 5 adult doses. So you draw 2 pediatric doses from that vaccine, and then you dispose of the rest of the vaccine because you didn't have any more patients. How many doses should you report as wasted in MyCAVax? So if you remember, there's up to 5 adult doses in these vials. And our options for how many doses you should report wasted are 3, 4, or 8.
All right, it's popped up. This is a scenario. Go ahead and put your answer in. You draw 2 pediatric doses from the Moderna Blue Cap vaccine, 6+ months, and dispose of the rest of the vaccine. How many doses should you report wasted? 3 doses, 4 doses, 8 doses? We'll give you a chance to respond. Again, wonderful participation. This is the audience participation part. Answering the knowledge check and getting involved will perhaps warm some of you up for Friday night karaoke, if that's your thing. But right now we are focused on vaccine, but we love our audience participation in our Friday provider webinar. So again, the scenario, you draw 2 pediatric doses from the Moderna Blue Cap vaccine 6+ months and dispose of the rest of the vaccine. How many doses should you report wasted? All right, hit that 50% mark. If you didn't answer, again, it's good for you just to have that sense of where you are in your understanding, and that helps us determine if we need to review this a bit more. So 3 doses, 4 doses, or 8 doses. Wonderful. Thank you for participating. Those numbers are still climbing, and we are going to close the poll in 3, 2, 1, and we'll share out the results. It looks like 59% said 3 doses should be reported as wasted, 27% 4 doses, and 14% said 8 doses. And Kate, what is the correct answer?
So the correct answer is 3 doses. So for these specific vials where you can either get the 10 pediatric doses or the 5 adult doses out, CDC has asked that for waste reporting reasons, you just act as if there's 5 total doses in the vial. So if you administer 3 doses, that would mean even though they were pediatric doses, then you would report, if you administer 2 pediatric doses, then you would report 3 doses as waste. And if you administered up to 5 pediatric doses, even though there's still some vaccine left in the vial, you wouldn't have to report any doses wasted. So it's just out of the 5 total adult doses in the vial, even if they're pediatric, you just act as if however many doses you administered, there's only that number out of 5 left, and that's what you would report for waste. So the answer is 3. And I know this is a pretty confusing thing with the two different options for how you administer doses out of it.
Thank you, Kate. And please know if you do have questions about this, you want to get a better understanding, please don't hesitate to ask questions about that, because as Kate said, it is a little complicated, and that's why we're doing the knowledge checks. So we have one final knowledge check for today, and we'll move on to the next slide and let Kate introduce that.
Okay, and our last question is, what should you do if your monovalent Moderna vaccine experiences a temperature excursion? And the options are contact the manufacturer, administer it ASAP, or dispose of it because monovalent Moderna is no longer authorized.
All right, we'll bring that up. And you have the opportunity to answer the final knowledge check of this Friday, May 19th, an exciting way to end the day or move into your day before heading into the weekend. What should you do if your monovalent Moderna vaccine experiences a temperature excursion? Contact the manufacturer, administer ASAP, dispose of it. Monovalent Moderna is no longer authorized. What should you do? And I'm seeing the answers pouring in right now. Thank you all for participating. Again, we always like to promise that virtual million will be coming. And we'll leave it at that, but we're seeing those answers come in. We certainly wish we could provide a virtual million to all of you, or at least buy you a cup of coffee. But in the meantime, thank you all for participating. And we are going to go ahead and end our poll. And We're going to share the results. What should you do if your monovalent Moderna vaccine experiences a temperature excursion? 12% said contact the manufacturer, 1% administer ASAP, and dispose of it. Monovalent Moderna is no longer authorized, 87% of you. And drum roll for Kate to give the answer.
Yeah, so the answer for this one is dispose of it because it's no longer authorized. So normally if your vaccine did have a temperature excursion, you would want to contact the manufacturer, but in this case, there's no point in doing that because we're hoping by now you guys have disposed of all of your monovalent Moderna as well as your monovalent Pfizer vaccines because they're no longer authorized. So yeah, in this case, we would want you to just get rid of it. And this question was just sort of another reminder for everyone to make sure that you are removing your monovalent Moderna and Pfizer vaccines from your inventory because they are no longer authorized. And those are the end of the knowledge checks. So back to you, Leslie.
Thank you so much. I really just want to acknowledge how much we appreciate the interaction. And if I could sing, celebrate good times, come on, I would, but throw out an emoji and give yourselves a round of applause for doing your best today. And this is why we show up every Friday, and we're so grateful you show up every Friday so that we can provide updates and education and clarification. So we certainly love our providers and appreciate the questions that come in. It helps us plan for updates and how we can best serve your needs. So with that, we're going to go ahead and move on to our next slide. We'll continue to monitor questions, but right now we want to hear a vaccine management update with Josh Pocus and Claudia Aguiluz for My Turn and MyCA Vax. Josh, would you like to kick things off?
Thank you, Leslie, and happy Friday, everyone. I don't have anything as fun as a knowledge check, but I do have some information for you. So next slide, please. All right, just two quick features that were deployed in our latest release. You'll see on your clinic list for the clinic managers, we've now removed the archive button or checkbox. I kind of forget which one it was, but it is now an active checkbox. So that should be automatically checked, and it will filter on active clinics. So you can manage your active clinics. If you want to see inactive or old clinics, you can uncheck that and hit search, and it will load your inactive clinics. Next slide, please. All right, we did add a bulk delete vaccine supply. So now that monovalent is no longer authorized, you can actually go in and clean up your vaccine supply in bulk. So take note of that. Within your clinic in the sub tab for the vaccine supply, you'll see a bulk delete there. And once you select more than one, you should be able to delete as many as you need to delete. Next slide, and I believe that's all for me. I'll pass it over to Claudia.
We'll make sure we
Thank
can
you very
hear
much, Josh.
there.
Good morning. Thank you. Good morning, everyone. Happy Friday. Sorry, a little delay. I'm double muted always. So what's new in MyCA Vax? So we have for you highlights for our release that is coming up this Thursday, May 25th, 2023. As you can see on this slide, there is quite a number of highlights that are coming your way for providers and a few for local health jurisdictions and MCE. So let me start with those. And so we have two for local health departments. And starting with the program highlights, you will be able to see vaccine requests, storage and handling, and site management tabs on the program staff tile under the related tab on the program location record. And speaking of program staff, you will see a program staff number instead of a program staff name, and will also see program staff number, contact, and role while you're searching for a specific contact. Now, moving on to the provider highlights that you can expect to see. Starting with a change on vaccine ordering, and this is a minor one, but we just wanted to share with you that if you have any draft orders that may be created in the system, these are not going to live forever in the system, but instead they are going to be deleted after 7 days from the order creation date. They will also receive a confirmation email for the same. And you will receive a reminder email about an upcoming expiration date 4 days from the order creation date. So we're going to give you a little bit of heads up on any draft order you have. On the program side, you will see highlights a highlights panel on a program location, displaying the account owner, MyCAVAX ID, also the IIS identifier, and a temporary closure information if that exists there. On the site visits, you will see additional fields that have been added there. For program staff, you will be able to see a program staff history on Chatter for any changes. And lastly, we will have some highlights added to location applications. Now let's go to the next slide and take a closer look at some of these highlights coming your way. Thank you. So starting with program location fields that have been or will be added by Thursday on site visit records. So you will be able to view fields from the program location under the provider information section on a site visit record. And this include whether this site is a depot, whether the site receives vaccine distribution. You will also be able to see the IIS identifier, and the COVID vaccination provider type will also be added on the site visit record. Next slide, please. Great. So we are also adding a reference to location applications on the program location. So you now may be able to view program locations applications field added to program locations. And you can see both of those program location fields that will be there for you. Next slide, please. And here is a little bit more specific info on the draft order deletion and reminder emails. So providers will have their draft orders deleted after 7 days from the order creation date. And you will also be able to receive a reminder email for an upcoming expiring draft order after 4 days from the creation of that order. And once that draft order has been deleted, you will also be receiving an email confirmation that that draft order has been deleted. So we have a couple of the sample of the emails that you can expect to see. Next slide, please. Great. And my last reminder for you has to do with reporting vaccine waste. And thank you, Kate, for the walkthrough on how to, a refresher on how to report. So Johnson, J&J expired and is no longer available for ordering on MyCAVAX. So again, we are asking you to make sure that you check your refrigerator, triple check your storage units, and ensure that doses have been removed and disposed of it. And then hopefully your computer is next to your fridge so that you can also make sure that you do the final step of reporting these doses in MyCAVAX. If you also need help, we are hyperlinking the reporting and disposing of non-viable doses job aid within the deck. And lastly, I believe that may be my last slide for you all this morning. Happy Friday.
Happy Friday. Let's go ahead and move on to our next slide. We do have an appendix from the MyTurn and MyCAVAX folks, so we'll move through the appendix, noting the icon key slide is available, and then the next is on some clinic best practices for creating multi-vaccine clinics. Moving on, we have the MyTurn and MyCAVAX help desk transition. It's still happening, and it really should not provide any disruption for you. This transition is just meant to inform you that this is going on. On the current slide, MyTurn known issues. This was updated 5/18 yesterday. These known issue slides are the known issue and the workaround next steps of dates that it is going to be fixed or determined to be fixed. We also have MyCAVAX known issues. Then on to the next slide. We have the release roadmap. So we do this for all three, MyTurn Public, MyTurn Clinic, and MyCAVAX. In the bottom blue banner, I want to highlight that there is a system feedback opportunity. If you have any feedback, you can submit that to the vaccine management feedback form team. If you go through that form, the team will get it. And again, this is about recently deployed, current, and upcoming releases. So this roadmap or timeline is just a helpful tool for you. And as we move all the way through these slides, we are now going to have our next presentation. We always enjoy Francisco Borboa coming on to talk about COVID-19 vaccine quality assurance. So Francisco, why don't you just go right ahead and take the microphone away?
Hello, thank you, Leslie, and good morning, everyone, and happy Friday. Next slide. We just want to remind our providers that if you store or redistribute vaccine, it's part of the provider agreement that you must accommodate one of the quality assurance visits. And we will be reaching out to you if you haven't participated in one of the quality assurance visits. If you need the language, you can click on the link below to actually look at the exact language listed on the provider agreement. Next slide, please. We want to let everyone know that so far for this year, we completed a total of 241 visits. 36 of those visits are being completed for a HRSA provider. 0 to date have been completed for an IHS provider, but we'll be completing 1 or 2 coming up next month. A total of 205 providers that receive vaccine from the state have been completed in a total of 36 depots or redistribution sites have been completed to date. The QA team by CDPH has completed a total of 140 visits, and 101 have been completed by our local health jurisdiction, with the majority by LA County, and we thank them so much for actually helping us with those visits. A total of 131 visits have been conducted in person, and 110 have been conducted virtually. Please know that we're hoping that we can visit you in person now, but we still do have that option of conducting virtual visits. Next slide, please. So far to date, of all the total visits completed to date, we have a total of 1,046. We have only 2 counties in the state that we have not visited yet, but we will be conducting a couple of those visits, and so far, the whole state will be actually at least conducted, 1 or 2 visits. So far, CDPH conducted a total of 400. LHJs contributed a total of 646 in person, 618, and virtually a total of 428. Next slide, please. We want to just show you that the top 5 non-compliant areas identified during these visits, these are as listed. In number 1, we still see that responding to vaccine administration errors is on number 1. It is extremely important that we try to utilize the provider operations manual to find those details and information to help your staff. If your site has not completed a visit yet, please look at the steps to follow in case of an event of an error. So please refer to the PALM page 118. In number 2, we find the ancillary supply kit defects reporting. The area that we identified that some of the providers are lacking knowledge of is reporting to the FDA if you find 2 or more defects in your ancillary supply kits. If you need more information, please go to the Provider Operations Manual on page 82 to 83, or click on the link. In number 3, we find providing the V-Safe information sheets to each patient after each vaccination. We did put the link on the V-Safe print resources for you to refer to. In number 4, utilizing qualified containers or backouts during transporting the vaccine is extremely important. That every time vaccines are moved, do not forget to use qualified containers, especially having a digital data logger and completing the documentation. For additional information, go to the PALM on page 101 to 102. And in number 5 for this month, we identified that the documenting and reporting temperature excursions has been, number 5. Please know that every time there's an excursion, you must document it, and then you should reach out to your manufacturer for feedback on the viability of the vaccine. So please refer to the PALM on page 89 to 91 for additional information on the steps. Next slide. And we want to share with all of you that basically our QA reviewers are actually taking on 2 sections of the state. We kind of divided the state by counties. So we do have, our contacts in emails should you need to reach out to our QA reviewers or myself regarding a quality assurance visit, please click on the link that is provided on the slide or on the chat, and just know the names are listed there. But as of now, we pretty much divided the areas so we can have a more accessibility for our QA reviewers, and the distance is actually shorter. So please use this resource outline to contact us should you have any questions about quality assurance. Thank you so much. With that, Leslie, I'll get back to you.
Thank you so much, Francisco. We'll move to our next slide, and we are moving toward our resources and Q&A for vaccine before we head into our COVID-19 therapeutics updates. Just some quick reminders on resources. The next slide provides information on easyIZ.org COVID web pages, and we are pointing to, it looks like the clinical job aids, the arrow got moved to the clinical job aids, so you can see that. I do also want to alert you to the top icons. Those are the FAQs, the provider webinar, and the crucial conversations and training calendars. Those little circles are quick jumps to those resources that we provide. So when you are on the webinars, if you are somehow missing the slide deck link, you can just click on that easyIZ.org COVID page, and hopefully it's starred under your work favorites, and you can click to get the slides and archive slides and recordings. This page is a wealth of resources for all things COVID-19. Next slide. COVID-19 Provider Operations Manual. We did a little walkthrough over the last couple of weeks. I won't be doing that today, but I do want to remind you this is a resource to download and share. That's right. It's my Friday Sharing is Caring shout out. The Provider Operations Manual includes all things COVID-19 vaccine, including information on ordering, receiving and storing vaccine shipments, routine tasks and reporting, managing vaccine inventory, a quick startup guide, information about patient visits, and my favorite part, the appendices that includes contact information and myriad job aids to support the work that you do. Next slide. COVID-19 vaccine provider FAQs now in their 120th iteration. They were just updated yesterday, and please look below that. There is a yellow star, and that highlights a new FAQ, and green below that is an updated FAQ. Those are included in the top of the table of contents. If you're looking at the right, all of those blue links are quick jumps to the item under the contents. Next slide. And we have next week, May 22nd, live webinars and trainings happening, along with view on demand and helpful information below for COVID-19, general information. And if you have MPOX questions, planning ahead, June is Pride Month, and there are going to be some resources coming down the pike for that. But if you currently have MPOX questions, I know that has been a focus of some of the CDPH pages getting updated. So we want to highlight that while we're not providing the updates now on these webinars, because I know someone had asked earlier, we are available for any questions, and we can certainly forward those questions to the appropriate personnel. Next slide. Hear it and clear it. Report any rumors to the cdphca.gov rumors at inbox. The trust and safety team still monitors that inbox for any mis, dis, or mal information. And as I mentioned earlier, if you have a question about what is mis, dis, and mal information, attend the Wednesday, May 24th webinar. Dr. Elon Shapiro is going to be on and talking about that very, very important subject. Next slide. COVID-19 vaccine support through the COVID-19 Provider Call Center, enrollment support, MyCAVAX Help Desk, MyTurn Clinic Help Desk, and archived communications are available. Next slide. And stay informed by being added to the CDPH messaging services. We just highlight this slide on the 1, 2, 3 on how to get signed up for important emails and newsletters. Next slide. All right, looping back to questions, and I'd like to invite Maria Volk to take us through some of your questions before we move on to our therapeutics updates. Maria?
Great, thank you very much. We did have a couple questions come in about vSafe after Francisco's presentation. And yes, we did want to acknowledge that vSafe has stopped enrolling new patients as of yesterday. So that would not be a requirement on QA visits or for clinics moving forward. So we will all be interested to see what will take its place on the top 5 list of non-compliant when Francisco presents next time. All right. I think Arlene was just answering a question about shipments and Memorial Day. Arlene, did you want to highlight your answer?
Good morning. Yes, so on Monday and Tuesday, McKesson will not be delivering any of the Novavax or Moderna vaccines. That's going to be the 29th and the 30th of this month. Pfizer will also not deliver on Monday, the 29th, but they will start the deliveries on Tuesday, the following day.
Great, thank you, Arlene. And we will have a calendar up. I don't know that if it's up yet, but close to being up, so it'll be posted and we'll include it in our weekly wrap up and such. All right. Kate, you got a couple follow-ups after your wonderful knowledge checks. I think people just wanting to like double, triple check that they were right. Did you want to just emphasize one more time? So if someone pulls, say, 8 pediatric doses from that Moderna product, do they have to report any waste?
Yeah, so in that scenario, if you pull 5 or more doses of either adult or pediatric from those Moderna vials, then you do not need to report any waste because CDC considers the maximum amount of possible waste from those doses to be from those vials to be 5 doses. So if you pull 4 pediatric doses, you would report one dose wasted. If you pull 4 adult doses, you would report 1 dose wasted. If you pull 5 adult doses, you would report no doses wasted. And if you pull 5 pediatric, you would also report no doses wasted, even though there's still like half the vial full. CDC considers if you administered 5 doses of either type, there's no waste.
Great, thank you so much, Kate. Katerina, there was a question that came in on the clinical side, and this was about if there was a patient who is 64 years old and they live with an immunocompromised individual, are they eligible for an additional dose after receiving the bivalent more than 8 weeks ago? Would you mind answering that one out loud for the group?
Sure. So just as a reminder, CDC's guidance is based on the age or the immunocompromising condition of the vaccine recipient. So there isn't any CDC language that would allow for additional eligibility based on the household contact. Although I think this person was about to turn 65 in a few days, it seems clinically extremely reasonable to proceed. But based on current CDC guidance, there isn't a specific allowance for this for the household contact.
Great, thank you very much. I'm seeing a question from Denise, and this is out to some of our participants. She was wondering if there are any other counties that are continuing to give COVID vaccine without the new standing orders. They have put all of their clinics on hold. So if anyone wants to weigh in, please hop into the Q&A and let us know how you are handling the delay in getting those standing orders. That would be great. I'm scrolling through. Let me just pause here and check in with our subject matter experts. Any other questions you want me to highlight or any thoughts that have come to mind that you want to be sure to share with the group? All right, not hearing anyone jumping in, but did want to also say that we had a question about whether this vaccine administration numbers included.
Maria, I'm so sorry to interrupt. We're getting now a breakup on your audio. Can we just do a quick sound check, as it sounds like we don't want to miss what you're saying?
Hi.
Okay, slight breakup, but let's try that again.
All right. If not, I'll let someone else take over. I'm just in my house. I don't know what's going on with my internet. Can you hear me now?
Yeah, we're unfortunately having such a difficult time hearing you. So I think let's just do a quick double check and see if we can get Maria back in a moment. Denise has a question, and if you are able and you want to share a peer-to-peer idea with Denise, feel free to open your Q&A and do that regarding our other counties continuing to give COVID vaccine without the new standing orders. We have put all out COVID vaccine clinics on hold pending the standing orders. And I am going to just invite you to add to that. And Carlos affirmed a great presentation. I agree. We would all feel more comfortable with the standing orders reflecting current CDC and FDA guidance. So thank you for your feedback on that. It looks like Josh is answering a question. I'm going to pause just to check in with our CDPH subject matter experts and panelists. Are there any announcements or thoughts or anything you'd like to share for the greater good of the attendees? Okay. Not hearing anything at this time. Francisco and Silvina, I do see hands raised. I don't know if you had a question that you wanted to ask this morning. We can certainly unmute you if you would like to ask our subject matter experts a question. But let's see if we get any response. The little microphone is red, and you can change that to gray if you want to ask. Just want to make sure we get your questions if needed. All right. Not hearing anything at this time. There's a good question from Anna. Can someone clarify what is meant by standing orders? I thought we don't need orders from MD for COVID vaccines. Would someone address that, please? Waiting to see if we have a subject matter expert speak up on that. Can someone clarify what is meant by standing orders? Any of our CDPH SMEs able to answer that? Anna, I am not hearing anyone unmute at this time. We might be experiencing some technical difficulties on that, but please know that your question is being collected, and I will definitely pass that on for someone to clarify what standing orders means, and we'll get back to you on that as we are able. All right. Just doing one more skim and scan. And one final opportunity here for our SMEs. And Carlos just added, standing orders approved by the CDC ensure that we are following CDC guidelines and not giving rogue instructions. Thanks for that addition, Carlos. Appreciate that. And got a question, it looks like, for the My Turn team from Elaine. For the bulk upload sheet, it displays first, second, third, bivalent booster, etc. Will that be updated? And Josh, would you like to just write it out or answer it out loud?
In short, yes. So we are, I mean, we know there's a lot of old monovalent language, and we were hoping to try to get that cleaned up in release 40, this next release. But we are currently cleaning up what we can. There is some pending language that's still needing approval to do the full cleanup for the public and clinic side for that vaccine supply, because there's a lot of places that touches. It's a very large cleanup effort. So we are planning that majority of, we should have everything cleaned up by the end of release 41. So that is release 40s in June, and the next release is a month later. So we should have everything cleaned up by R41 currently. That's our plan.
Thank you so much, Josh. And Dr. Liu is providing a link. And Dr. Liu, would you just like to share? We are at the top of the hour, but we do have a couple extra minutes. This is an important question regarding Anna's question about standing orders for clarification.
Sure. I can certainly share this information, and so I will put in the chat a link to a definition from the Agency for Healthcare Research and Quality that summarizes standing orders and protocols are tools to allow patient care to be shared with non-clinician members of the care team. And as Carlos mentioned, ensures that everyone is following the same instructions. We can put also in the chat the examples of the current standing order documents, and you can see what's in them, which summarizes very detailed information on a very concise page in terms of what to do. And then I think some of the more detailed, if you have more detailed questions, maybe you can put them into the Q&A and we can look into any kind of other considerations and more detailed answers.
Thank you very much, Dr. Liu. And we are at the top of the hour, and we're going to continue to review questions. In the meantime, we'll move on to our next slide because we don't want to miss out on some important COVID-19 therapeutics updates for providers. On the next slide, we just want to remind you that you continue to ask questions, but if you have any post-webinar questions related to therapeutics, please email selena.folston@cdph.ca.gov. And we'll move on to our next slide and discuss. We can move beyond the housekeeping. I think we know what's happening at this point, and we're going to hear some announcements from Selena Polston. We are going to hear PrEP Act and emergency use authorizations with Dr. Edward Salaginto, and storage and handling with Alan Hendrickson before resource and Q&A. Next slide. All right, I'm going to turn it over to Selena Polston to give our COVID-19 therapeutics updates. Selena?
Hi, Leslie. Thanks so much. And our first announcement, next slide, is a really exciting one, and one we have got a lot of questions about over the last couple of months, and that is what will happen to state telehealth after the end of the public health emergency. And we do finally have some information, and that is, for the time being, or pardon me, through February 2024, the state-sponsored telehealth program for accessing COVID-19 therapeutics is going to continue. So that will be available through February 2024, possibly longer. We're not sure right now on who will be the vendor, and so we will let you know about that as soon as is possible. But through February 2024, you will have all of your patients and your community will have access to free telehealth. All right, next slide. Wanted to remind you, Memorial Day is coming up, and we will have a little bit of a different schedule for the delivery of therapeutics. We will be closed on Monday, May 29th, and as a result, the threshold and top-off date for shipping of therapeutics will be Tuesday, May 30th. Next slide. Real quick, just wanted to direct everybody to a couple of fact sheets and resources if you haven't seen them already. One is a fact sheet that goes over some of the key points of the end of the public health emergency from the Department of Health and Human Services. It's linked here at the bottom. The most important piece, which you probably are already familiar with, but we wanted to really make sure, to highlight here, is that that nothing will really change as far as access to COVID-19 treatments after the end of the public health emergency. Really what will change is once the federal government is no longer purchasing or distributing treatments, that is when payment coverage and access may change. All right, thanks so much. Moving on, I think we have one last update. And this is also another fact sheet from CMS, and it goes over some of the waivers, specifically what folks can expect regarding COVID-19 vaccines, testing and treatments after the end of the public health emergency, telehealth services, which we just went over, also healthcare access. What are the continuing flexibilities for healthcare professionals? And finally, what will it look like inpatient hospital care at home and expanded hospital capacity by providing inpatient care in a patient's home? So the fact sheet regarding all of the different CMS waivers is linked there at the bottom. I think that's the end of our therapeutics announcements, Leslie.
Thank you, Selena. We'll move on to our next slide. And we have PrEP Act and Emergency Use Authorizations with Dr. Edward Salaginto. Ed, the mic is yours.
Thank you, Leslie. Thank you, everyone. Next slide, please. All right, so we've gotten past another end of emergency declaration last week. And just to summarize, the slide shows the declarations that have come and gone, and also the 2 remaining declarations that are still in play. Remember, there are several types of declarations and determinations related to emergencies, and they all serve different purposes. So to go over them, February 28th, Governor Newsom ended the public health emergency in California, and this affected some DCA waivers, among other things. On April 10th, President Biden signed the end of the national emergency declaration, and that allowed Congress to act on certain things as well. But typically when you hear public health emergency, people are usually referencing the declaration by the HHS secretary that was a public health emergency exists under Section 319 of the Public Health Service Act. That end date was May 11th last week. So the declarations that are still going are the PrEP Act declaration and the EUA declaration. Both are also issued by the HHS secretary. Next slide, please. Okay, so on May 9th, the HHS secretary signed the 11th amendment to the declaration under the PrEP Act for COVID-19 countermeasures. The secretary issued this amendment to clarify that COVID-19 continues to pose a credible risk of a future public health emergency. So this extends the time period of coverage for certain covered countermeasures, including manufacturing, distribution, and administration of covered products through December 31st, 2024. It clarifies the time period for coverage of covered persons authorized under the declaration with various start dates and also ending on December 31st, 2024, and extend the whole duration of the actual declaration to December 31st, 2024. But note that the PrEP Act declaration fact sheet that we referenced in April, those provide general information, including what's no longer covered under the PrEP Act declaration. However, the actual declaration itself, it only lists the things that are currently covered. So the things that aren't removed from one amendment to the next, those don't really transfer into the current status of it is. So you do have to compare them side by side. So to determine every change, you have to compare each amendment. And the fact sheet just simply provides assistance for that comparison. For CDPH and DCA, we do still encourage interested parties who want to review the PrEP Act with your legal counsel to determine eligibility for pharmacists to continue independently initiating and furnish Paxlovid to individual patients. However, it looks like therapeutics for pharmacists ordering therapeutics under the PrEP Act, we expect that it'll be covered under the PrEP Act, but please review with your legal team to determine that eligibility. Again, stating that the end of the COVID-19 public health emergency declaration on May 11th of last week, that doesn't terminate the PrEP Act. But for more information, you could still look at the COVID-19 PrEP Act FAQs, which we included here. HHS said they are going to issue additional guidance soon, and we'll share that as soon as we get it. Next slide, please. Okay, so EUAs will still stick around. A separate declaration is needed under Section 564 of the Federal Food, Drug, and Cosmetic Act to enable the FDA to issue EUAs. Remember, this declaration is specific to EUAs and it's not linked to any of the other emergency declarations. So the FDA commissioner requires several steps to give a EUA on a product. First, one of the 4 top bubbles must be in place. And then after that, the HHS secretary issues the EUA declaration. And then from there, the FDA commissioner, in consultation with HHS or ASPR, CDC, the NIH, then they can issue EUAs for individual products. It's in this step where things within an issued EUA can change. And we've seen them change with vaccines and even some of the therapeutics. And then finally, the last step in the process is termination of the declaration of EUA when circumstances show it's no longer needed. Next slide, please. So we've shared this slide before, but I think it's an important slide because these questions come up often. That first question there, can EUAs continue after the public health emergency is over? Remember, EUAs can remain authorized as long as the EUAs are issued under the EUA declaration. And that's still in effect. But the declaration under 319 of the Public Health Services Act, that doesn't matter. But the declaration under the Food, Drug, and Cosmetic Act, that does matter. An easy way to look at it is just for watch what the HHS secretary says and does. EUAs can generally continue until the HHS secretary terminates it. All right, the next one, once the public health emergency is over, what becomes of the medical products? Well, once the EUA declaration is terminated, notice that termination will be published in the Federal Registrar. And then from there, instructions will be issued by the FDA or CDC on how to handle the remaining product. Sometimes they'll have you dispose of it and destroy it, and sometimes they'll have you hold on to it until the product might be viable for future. But within that, there is going to be instruction from FDA or CDC on how to handle the remaining product. And then finally, how are they terminated? Well, if circumstances justify that the individual product no longer exists, then the FDA can terminate individual EUAs or deauthorize them, and we've seen that with some products. But broadly speaking, when an EUA declaration is terminated by the HHS secretary, then all of the EUAs issued under that declaration will be terminated also. Let's see, I think that's it for me. Thanks, everyone. Thank you, Leslie.
Thank you, Ed. Let's go ahead and move on. And storage and handling will now be provided by Alan Hendrickson. Al?
Thank you very much, and happy Friday all. Next slide, please. Destruction of therapeutics. We've had a couple questions come in of late, so we thought we would revisit this. Not much has changed since the original ASPR guidance came out. So if you have a destruction plan at your facility, you may destroy the therapeutics as long as it's expired product or any of the unauthorized products that can no longer be stored. So we have a lot of legacy MABs out there. If you're having trouble storing those, they're blocking up that refrigerated space, you may also destroy those. If your therapeutics have not expired, now talking Paxlovid and Molnupiravir, they would ask you to look at an alternate storage location. You could move them around to another provider. Unfortunately, we can't take those back at the West Sacramento warehouse because we are a licensed pharmaceutical wholesaler. So anything that's returned to us has to be destroyed. So if you do choose to destroy those products, just remember you need to enter that into HPOP, quantities destroyed, as well as the self-attestation that you're following all those regulations. Next slide, please. And as far as the shelf life of all those therapeutics, most of the therapeutics have been authorized shelf extensions throughout. So if you've got Paxlovid, go ahead and check out their site here listed at the URL. All the others are searchable at the ASPR site that's listed on the page here. So please check those to make sure your therapeutics have expired before you destroy those. And I believe that's it for me, Leslie.
Thank you, Al. Please note, as you are looking at these slides, just a reminder, within the therapeutic slides, these links that are provided are in blue on the therapeutic slides within the body of a slide, and in white in the bottom blue banner. We do want to ensure you are accessing all links that are provided. We'll go ahead and move on to our next slide. And on the next slide, we just want to highlight that there are resources available, and making sure that you are aware of emails, any phone numbers, hours of operation. Please make sure you have this resource on your desktop or on a PDF for your staff should they have any COVID-19 therapeutics questions. Next slide, please. All right, we have had some questions come in, and again, a reminder that we will always do our best to get questions answered in real time. And if we can't, we are collecting them, but our subject matter experts for vaccine and therapeutics are reviewing all questions that have come in. And we do note that standing orders are, it's a hot topic, so we're doing our best to find out information to provide for all of you in future updates sooner than later, we hope. Again, we are still, as Dr. Liu said, waiting on CDC. But I do want to comment that do see some therapeutics questions, and seeing some of those answers, I'm going to go ahead and bring them forward for the greater good of the group. Parthana had asked, will the COVID-19 hotline continue after June 30th? Kenna, would you like to share your answer?
Sure. Hi, everyone. We are very hopeful that there might be an extension of the warm line, but it is not official or approved. And so we will let you know as soon as we know anything about a potential extension of that service.
Thank you. Thank you for your question, Parthana and Arnie, regarding that warm line. Glad to have you ask that and taking a look through. Ed, I know you're typing out an answer. Minda had asked, do you have updates regarding the PrEP Act with nursing students, LVN, RN that can administer vax by themselves? Did you want to just share aloud any thoughts about that?
Sure, I'll take a stab at it, but note that I am not a lawyer. I am a pharmacist, but in reviewing the PrEP Act, I did not see students or non-traditional vaccinators included in the new amendment. But I do want to remind people that interested parties who do want to evaluate the PrEP Act, please do it with a lawyer. Just to determine your eligibility to continue administering COVID-19 vaccinations. CDPH, we don't have that jurisdiction to have over licensees. That's the Department of Consumer Affairs. Again, we don't license these professions, so we do defer to DCA for comprehensive and authoritative legal review for providers' authorities to continue to administer vaccines.
Thank you for that, Ed. And I appreciate the clarification. We rely so much on Dr. Salaginto. We think of him as wearing many hats, but I appreciate that. Pharmacist only. All right. And then we do see a link that Emily Estes dropped. And Emily, if you're able to share regarding Na's question for private insurances, are they still free for treatment, or does it depend on an individual's insurance? Did you want to talk about that briefly?
Yes, I can definitely talk about it. Good morning, everyone. So the short answer is that it does depend on insurance. The long answer is that if an individual's insurance plan is regulated in California, so if it's regulated by DMHC, then California law applies, and that means that there's coverage with no cost sharing for in-network providers for vaccines, testing, and treatments. That includes 8 over-the-counter tests per month. That continues on in perpetuity. Starting November 11th of this year, the requirement for coverage with no cost sharing for out-of-network providers ends. So people still have to have, these insurance plans still have to cover out-of-network providers, but they can implement copays and stuff like that. On top of that, regardless of the insurance type, COVID treatments that are being distributed by the federal government, which include Paxlovid and Molnupiravir, those will continue to be free as long as they are not commercialized. And we don't expect that to happen until the fall. I think that covers the full question. Again, that table that we put together, I think, is a helpful resource where it goes through by insurance type and by vaccine, therapeutics, and testing, what is covered and through what dates.
Emily, so appreciative of that answer. Glad you can clarify. And if you have questions further or need clarification, don't hesitate to drop that in to the Q&A. Still monitoring some questions here. It looks like Naomi has a specific question about standing orders. And Mustafa, we see your question. Again, we'll do our best to get that answered or collected for the proper personnel to take a look at that. And Kelly, thank you. It does look like there was a question, and Ed provided a link regarding RN students giving vaccine. Ed, is there anything you wanted to say aloud about that? I just want to draw everyone's attention to the link and your comment.
Sure. So what the PrEP Act did was they allowed non-traditional vaccinators to help out with the effort of administering vaccines. Non-traditional means that if before the PrEP Act was issued, you were not allowed to vaccinate, that would be a non-traditional vaccinator. If the PrEP Act allowed you to vaccinate or administer, that would be non-traditional. But if you were allowed to vaccinate prior to the emergency or prior to the PrEP Act being declared, you would be a traditional vaccinator. So those would come back into play, and you would still be able to continue as you were.
Thank you for that. All right, taking a look through. It does look like Yolanda is looking for an email for IT questions. If there's someone on the call that would have an answer that could be typed in, that would be great. Otherwise, we'll pull that question. Mustafa is asking about getting paid for COVID vaccine administration for patients without insurance. We have more than 1,000 COVID administration not paid. Please advise who to contact. I don't want to overspeak, but Ed, I'd like to ask you to maybe step in on that one.
Yeah, so we've seen a few of these in the past, especially after March of last year when the HRSA fund ran out. But in good faith, many of the providers out there kept continuing providing vaccinations, and some with uninsured. There's a very difficult pathway to get reclamation for those, and that's to enroll those patients that you provided into the uninsured program under DHCS. That's going to be very difficult to do this if it was very far in the past. What you would have to do is enroll all of those patients into the uninsured program and then resubmit as a retro bill.
Thank you for that. All right. I have highlighted questions that have come in, and I would like to just bring Naomi's question because, again, we realize this is a hot topic. If there's anyone on the vaccine side of things, Regarding standing orders, Naomi says we have signed standing order for COVID vaccinations and have scheduled COVID clinic for tomorrow. Can you please clarify, should we cancel our clinic due to the standing order?
Hey, Leslie, I'm gonna see if I'm a robot still. This is Maria.
You sound fabulous, Maria. Go right ahead.
Okay, great. We just wanted to emphasize that, the CDC created those standing orders to be helpful and for convenience. Obviously, things have changed so many times through COVID that it's been particularly helpful to have CDC update those. But it is certainly acceptable for an LHJ or organization to have their own signed standing orders. And in fact, that is really the typical experience with routine vaccinations. CDC does not create standing orders for all vaccines. So it's typical that an organization would create their own standing orders. So Naomi, it's absolutely fine if you do have a standing order that has been created and signed by your organization. You are free to continue.
Thank you for that, Maria. And I do see Anna has a question. After COVID vaccines become commercialized in the fall, are pharmacies no longer required per this program to provide vaccines to all individuals regardless of insurance? Do we have an answer to that question, or is there more to come?
This is Maria. Maybe I'll jump
Leslie,
in
this is
again.
Claudia.
Oh, go ahead, Claudia. You can answer one.
There you go. So once we transition to commercialization, what happens or what will happen is that we will follow the routine path as all other routine vaccines, which is you would have to purchase your own supply of vaccines to be administered to those individuals that are insured. And then for those individuals that are participating in a public program, then they would be eligible to receive vaccines through that program. Now, for pharmacies, this is interesting because I think and I don't know if anybody else can also speak to the Bridge Access program, because they would be that component of the program to offer COVID vaccines to uninsured individuals. But for those insured, you would follow the same procedure that you follow for all of your non-COVID vaccines. And influenza or hepatitis A is a perfect example that you would have your own supply of privately purchased vaccines. And you wouldn't be required to provide vaccines to all individuals.
Thank you for that, Claudia. Have under 2 minutes and just want to pause in case Josh or any of our subject matter experts, Ed, anyone want to speak up about any item to clarify?
So maybe I'll jump in to help with Yowanda's question regarding Epic. So CDPH doesn't provide support for third-party applications such as Epic. We can give you, the clinical team and call center can help with just recommendations to align with COVID-19 guidelines. But as far as the application Epic itself, there's not really a call center to help with that, unfortunately.
Thank you, Josh. All right, we're going to move on to our final slide. I'm going to eke out every second we have together, but bringing up the final slide as we do a skim and scan of Q&A if there's anything further. Just a quick reminder that the next My Turn and My CVAX office hours will not be held until Monday, June 12th. Again, we have the Memorial Day holiday on Monday, May 29th. More to come then for those My Turn and My CAVAX office hours with demonstrations and updates. We will be together this upcoming Friday, May 26th. As mentioned, we will have Dr. Erica Plott on the call to provide some items for all our providers, and our next session will include COVID-19 vaccine update. And looking back through, I just want to thank all our panelists and our subject matter experts for being on the call. And just Catherine mentioned that Ed's section, Dr. Salaginto's section on PrEP was helpful. Could we request for a future meeting topic to have a summary of the Bridge Access Program as well and what its implications are? Maria, did you want to say something about that?
I was just going to say, yes, absolutely. The Bridge Access Program is on all of our minds. There's very little we know at the moment, so we'll definitely share with you as we learn more, but we expect that to be a big topic on these meetings in the coming months.
Thank you so much. And with that, we are at the 10:30 mark, and we want to thank you all for your time, your attention, your attendance, your questions. We hope as we conclude today's call, you stand and stretch, eat something nutritious and delicious today, hydrate, breathe, and do something that brings you joy during the weekend. And with that, we want to thank you for your faithful attendance. It is our pleasure to be here each Friday, and we want to wish you all the best as we continue to work together to keep California safe, healthy, and well. And with that, we'll conclude today's call. Thank you all.